Welcome to today's episode of Visit. Thank you for being here. And I would like to thank you again for all those very, very interesting letters. And today we will deal with the topic that I found several times, which is the question about scars. We don't really focus on scars. The surgical techniques are getting more advanced. The scars are getting smaller and smaller. And yet they can trigger more than we believe or think. The extent to which a scar is a so-called interference field is what the neural therapists know. They are colleagues who are specially trained in a special injection technique of neural therapy. Scars are scars forever. They don't necessarily look noticeable. There are also keloids which then tend to grow in a very bulky manner. There are also scars that are sometimes livid or reddish. But in general, a scar is quite nondescript. But scars can block. And they can block a very crucial flow of information. If you have already watched several episodes of Visit, then you know that I talk very often about what the 5,000 years old Chinese medicine has done. There has been empirical medicine for 5,000 years, and that's a different way of looking at disease development. Namely the understanding of the energy channels. Chinese medicine speaks of meridians. 6 meridians in the front, 6 meridians in the back. This means that these main meridians have energetic supply tasks. Without energy, and without this information about these energy channels, our body cannot work in the same way. And that's why you always have to know that in a society we live as human beings by giving and taking. It is very different in our body. Each organ prepares for the other. Everything is always dependent on the other. And so this flow of energy through these energy channels is the basic requirement for the execution of all these functions that take place there. How does my pancreas work? Does it have too little energy? Is it constantly weak? Because my 2.6 tooth is dead and blocks this energy channel. Can I advise a woman well? For example, if she has developed breast cancer and she had a disruption of the energy pathway there through the thyroid scar, what does that mean for a relapse? What does it actually mean for the other supply tasks when an energy channel is blocked? There is a colleague in Tübingen who wrote a doctoral thesis many years ago and found that human connective tissue, the connective tissue in us all, is actually the space that is between the cells. So the heart is embedded in the connective tissue. The kidney is embedded in the connective tissue. The brain, the liver, all of our organs are embedded. And this connective tissue system, Fisinger speaks of the matrix, also the Fisinger Rome. Everything runs through there, every nerve, every artery, every vessel that brings the blood into the body, every vein that leads it back again. Every nerve channel, every lymph channel runs through the connective tissue. And he found out that from this connective tissue, small nerve tracts constantly run to the surface. that are specifically coordinated with one another. And with it he found what we very easily think today, that acupuncture may not have been recognised for many decades, and thank God, finally it is now. Back then, he was able to prove what happens if you insert this needle exactly near this point. What are you stimulating? This is information that is now not limited to the point, but rather into the system, into the connective tissue, and thus, in general, a signalling or an information chain is activated. Scars, dead teeth, chronic sources of inflammation, such as the paranasal sinuses, can be interference fields. What is an interference field? An interference field is a process that blocks a meridian course. But the disease or symptom is far from any interference field. These scars have skin resistance. And with a suitable device, we can measure this skin resistance. If this skin resistance does not correspond to that of normal skin, the device indicates by means of a signal, then this scar is identified as an interference field. For example, women who have had a caesarean section and still have a scar suffer very often from back pain. The injection underneath this scar, the elimination of interference from this scar in order to restore the flow of energy, relieves the back pain. We have patients who come regularly. Others too, who just keep knowing exactly when the back pain builds up again, maybe my scar is interfering again. There are scars that we can only infiltrate once, or we infiltrate them once and always when we measure them this scar regulates. But I experience it very often, and in the majority, that scars need this interference suppression again and again. And now, of course, there are people who, for heaven's sake, don't like the idea at all of an injection underneath the scar. Although I have to tell you, this is a very, very, very gentle injection. Procaine is used here, which is a medicinal anaesthetic. Procaine 0.5 or 1%. It is so used in medicine, for example, when you are treating a tooth. Then Procaine or lidocaine is temporarily injected. But it is not the aesthetic effect that is used. Whenever Procaine is infiltrated into an interference field, only this energetic contact is actually re-established for the cell. The transformation of information can contact the cell membrane potential, and with that the regulation. The energetic transfer of information is closed again. This Procaine, as I said, is injected subcutaneously under the scar. You can also use lidocaine or other anaesthetics. Mepivacaine, for example, is also a very good anaesthetic to use. And with these things alone, you have an incredible improvement of the regulation performance. So when people have a lot of scars, sometimes it's not that easy because you have to identify them and treat those scars. For the last nearly 30 years, I really experienced small miracles, and I think that is also a care of us doctors. To examine people for scar interference fields because of their sometimes post-operative conditions. And if they can't examine this, then please be sure to give the recommendation that scars need to keep being treated. You can do that, for example, if you have a dry brush, and brush these scars dry daily. And I hope you'll do it because you'll naturally activate the microcirculation, this blood flow to our smallest vessels. And the small vessels attached to the muscles, to the heart, to the kidneys, to connective tissue, everywhere. They provide us with oxygen. You should do this dry brushing in the morning, always with a strong pressure upwards and a light pressure downwards. And really stimulate it for 3, 4 to 5 minutes, right in the morning after drinking well. And then take a shower. But please include your scars in this dry brushing. Stimulate these scars again and again. Whether that is the appendix scar, by the way, we all have a scar, that's our navel, and whether these are the hernias, so inguinal hernia scars, shoulder scars, back scars, condition after bacilloma removal, sometimes small scars. And it's very interesting how some people say, "Oh, I forgot to tell you." And then it was a scar on the left ankle. And all of a sudden it starts very quietly to change. Just pay attention. We know the Honecker second phenomenon in neural therapy. So if something was chronically painful, a disorder, or a real quick symptom, and by eliminating interference fields, a further therapy is no longer necessary at all. And within a short time after the injection, one speaks of this second phenomenon according to Honecker. I've been able to experience this several times, and that's why I'm so focused on looking at scars and keeping an eye on them again and again as part of a treatment. Right now, I have a patient who is suffering from declining performance of her memory. But it has also repeatedly been noticed that the kidneys seem to be ailing in their elimination ability over and over again. And she has a very big scar. The whole head was opened by an accident, which really looks like a triangle over the whole head, and which just reacted as if the light was drawn in all at once when we injected something underneath the scar. If you integrate a scar into your daily dry brushing, you should put a scar ointment on it that contains electrolytes. There are different ones. I use the ionic ointment, available in Germany. Or you can certainly do that with other things, but what is important is that it contains electrolytes so that the cell in its cellular communication will be able to transport this signal again tomorrow. Think about scars, think about pock marks too. Meridians run here over the shoulder and neck area. This is the so-called lung-colon meridian and the heart and small intestine meridian. The latter correlates with the small intestine but also with the heart. Scars can block transmission or such meridians or functional circuits, but also dead teeth. Please remember that if you still have wisdom teeth, if you still have impacted wisdom teeth, they are dry and good and warm. But if you have no complaints here, but still suddenly complain of cardiac arrhythmias up to perhaps atrial fibrillation, if you complain of shoulder and neck discomfort and so on, please don't forget, if there is a disorder of the lung, colon or heart and small intestine meridian, to think about the teeth, and here, above all things, please, the wisdom teeth. I wish you have just as good an experience in scar treatment as I had. We can measure that. Not every colleague can. But even to do scar treatment would be very important. We can also work with the infrared laser and suppress the scars. There are various techniques that colleagues also practice to eliminate the interference of scars. I also know about the possibility of bioresonance therapy. I just wanted to tell you that a young woman wrote that for several years, about 3 or 4, she has had a problem in the left hand. She herself is right-handed. The pain is in the joint or always in the carpal bones, depending on movement, but also in a calm position. The pain is sporadic, but she also has a scar on the left hand over the artery from an accident 20 years ago. And scars may not be an interference field for decades. Scars can become an interference field, and that's where things get interesting. And then this regulation blockage arises. This is why you take scars seriously, even if they are small, even if they look really beautiful. Shoulder problems after bypass surgery. Of course, these are not pleasant injections, but they suddenly bring a relaxation, a relief of pressure, which is unbelievable. And if you may not feel the current success that much, your body suddenly changes. It is easier for it. And it can now take over things again, and by that transfer energy much easier and simpler than you think. And with it maybe also work on something that you still do not feel so strongly symptomatic yet. To see scars, to search for scars, to take scars seriously. That is a very important task. There are many people with chronic complaints that they do not associate with scars. And apart from the fact that there are, of course, also emotional scars, which, of course, cannot be dealt with through neural therapy. But maybe with geranium. Because geranium is the great shock agent that can also resolve such a trauma. Or with arnica if there is a bump or swelling. Or a bruise. Then you can regulate it very quickly with arnica. In the case of insect bites, please use ledum for burns, hypericum or St. John's wort, or ledum for all tick bites. Take ledum C30 when the tick is already bitten. Remove them quickly because the spirochetes live in the intestine. So the tick shouldn't be really strong. And remove it by rotating it. You shouldn't squeeze it. Just cut with a razor blade. There is no danger from the head. But take ledum C30 3 to 5 globules 3 times over the next 3 or 4 days. I have actually not experienced the development to what is known as Lyme disease if you immediately focus on the immune performance and activate it, so that this intruder cannot actually do anything. This is a little discourse now because we're talking about scars. But there are also other possibilities where scars might remind us for the rest of our lives of something that happened many, many years earlier. I'm also very concerned about the burden of young people with all the piercings Of course, these are scars and they remain. Or all the tattoos. And maybe it will be also necessary to make a separate episode about this. What is actually in the tattoos? What is in these dyes? Where do they accumulate? And what kind of long-term consequences can they provoke on a health level? But I don't want to go any further. I want to come to the end and actually just make you aware that you also must understand the body. If it is blocked in its ability to regulate, then it cannot maintain the function as it would like. And our body can actually do everything without many things. From the outside, I don't want to say without everything. Of course, we have to make sure that we drink healthy water, that we breathe healthy air, that we consciously eat and not accumulate things it cannot use at all. It has to be high quality. It is very important that we get enough sleep and a good life hygiene and also live a healthy lifestyle. But it really does everything else on its own. And it has only one goal every day: to create the balance and the equilibrium and do it with an optimum of strength. Not overdoing it. It will only do what it needs and sets its own priorities. And scars can subconsciously bring it into distress along the way, because then it cannot perform these tasks for us in the same way. That is why you should always keep an eye on the scars. Colleagues who are familiar with neural therapy are very familiar with the topic. This is the Society for Neural Therapy in Switzerland, as well as in Austria and Germany. And if you contact a colleague about this, then this is the first point of contact, but there are a lot of open and knowledgeable family doctors who have already dealt with this question and have then found their own way how they can deal with these scars. But to take care of the scars, and first of all to be aware of them, was my concern now. With this in mind, I thank you from the bottom of my heart for your attention, and I am really looking forward to next Sunday and all your really interesting correspondence. Thank you very much, and goodbye. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.